Radiopharmaceuticals contained radiopharmaceuticals, radioactivity, measurement of radioactivity, properties of alpha, beta, and gamma radiations, half-life, radioisotopes, and study of radioisotopes, in which iodine, sodium iodide, I-131, storage condition, precautions, pharmaceutical application of radioactive substances. So, what is radiopharmaceuticals? Radiopharmaceuticals, as the name suggests, are pharmaceutical formulation consisting of radioactive substances, radioisotopes and molecular labeled with radioisotopes which are intended for use either in diagnosis or therapy or diagnosis. The use of radioactive material necessitates careful and safe handling of this product by trained and authorized personnel in approved authorized laboratory facility as per the guidelines of Atomic Energy Regulatory Board AERB of the India. Radiopharmaceuticals are essential component of nuclear medicine practice where radiopharmaceuticals are administered to patient for diagnosing, managing and treating number of diseases. Nearly 95% of radiopharmaceuticals are used for diagnostic purposes while the rest is used for therapy. Definitions and terminology. A nuclides or a nuclide from the nucleus, also known as nuclear species, is an atomic species characterized by the specific constitution of its nucleus, that is, by its number of proton Z, its number of neutron N, and its nuclear energy state. A radionuclide, that is radioactive nuclide, radioisotopes or radioactive isotopes, is an atom that has excess nuclear energy, making it unstable. This excess energy can be used in one of three ways: emitted from the nucleus as a gamma radiation, transferred to one of its electron to release it as a conversion electrons, or used to create or emit a new particles, alpha particles or beta particle from the nucleus. So what is isotope? Isotopes are variant of particular chemical elements which differ in neutron number and consequently in nucleons number. All isotopes of given element have the same number of proton but different number of neutron in each atom. Isotopes of an element are atoms of same element with the same atomic number Z but the different atomic mass number A. They occupy the same space in the periodic table and have similar chemical properties. Radioactive decay, also known as nuclear decay, radioactivity, radioactive disintegration or nuclear disintegration, is the process by which an unstable atomic nucleus loses energy by radiation. A material containing unstable nuclei is considered radioactive. Three of the most common types of decay are alpha decay, beta decay, and gamma decay, all of which involve emitting one or more particles. Types of decay: alpha, beta, and gamma radiations. Radioactive rays were observed to be as of three types. First, alpha rays which could barely penetrate a piece of paper, beta rays which could penetrate 3 mm of aluminium, gamma rays which could penetrate several centimeters of lead. We now know that alpha rays are helium nuclei, beta rays are electrons, and the gamma rays are electromagnetic radiations. Units of radioactivity. The old unit of radioactivity was Curie, named after the scientist Madame Marie Curie and the Pierre Curie, the pioneer who studied the phenomena of radioactivity. One Ci of the number of disintegrations emanating from 1 gram of radium 226 and is equal to 3.7 into 10 into 10 bar cube. In the international system SI, the unit of radioactivity is 1 nuclear transmutations per second and it is expressed by Becquerel, named after the scientist Henry Becquerel. Half-life of radioactive elements. The decay of individual atom of radioactive substances has been found to be irregular. If a certain amount of radionuclide is taken and the number of disintegration per second is measured, it is found that after a certain time, half of the original atom could have got disintegrate and only half of the original atom, active atom, would be left behind. The number of disintegration per second will also now be half of the original value. The decay time of radionuclide to its half has been constant irrespective of the quantity present. The time is termed as half-life of the radionuclide. T half is equal to 0.693 given divided by gamma, where gamma is disintegration constant in unit of second inverse. Half-life of various radionuclides vary considerably. Polonium 212, half-life of 3 into 10 raised to the power minus 7 second. Iodine 131 has 8 days. Zinc 65 to 150 days. Sodium 22 to 2.6 years, while uranium 238 has 4.5 into 10 raised to the power 4 years. So next monograph, sodium iodide. It is indicated 1I131. Synonym radioactive iodine. Out of the radioactive isotopes of iodine is most commonly used is I131. It is used as an aqueous solution of sodium iodide having sodium thiosulfate in addition as a reducing agent. Standards: it should not less than 90% and not more than 110% of labeled amount of iodine I131 as a iodide, which is expressed in microcuries and or millicuries at the time of indicating in the labeling. Method of preparation: the first production of iodine I131 took place in France in the year 1949 at the Fort de Chillon, the site of first Zoe atomic reactor. Before it was transferred to the Nuclear Research Center at Sclare, the isotope has been used since 1942. However, in the treatment of thyroid cancer, most I-131 is prepared as nuclear reactor by neutron irradiations of natural tellurium target. Irradiation of natural tellurium product almost entirely I-131 as only radionuclide with half-life longer than hour. Ultimately, in 8.02 days, it gets converted into xenon 131 stable isotopes. Properties: it forms a colorless solution. I-131 has half-life of 8.4 days and emits beta and gamma radiations. Its solution is having pH ranges 7 to 10. Assay: it is possible to determine its activity using suitable counting equipment by comparison with a standard I-131 solution or by measurement of an instrument calibrated with the aid of such solution. Iodine 131 has been emitting both both beta and gamma particles in its decay process. Radioactivity has to be recorded on the continuous assembly, which is having either Giger-Muller counter. It is also indicating GM counter, scintillators counter, detector used as a sensing unit and electronic sealing device. Then next one is hyperthyroidism treatment by I-131. So, iodine inhibits the release of thyroid hormone and form the basis of its use in hyperthyroidism. All the isotopes of iodine are rapidly taken up by thyroid follicles. Radioactive iodine, that is I-131, is available as sodium iodide 131 solution and it is administered orally. The absorption of I-131 leads to highly localized destruction of thyroid follicles due to beta particle emission. This property of I-131 has promoted radioactive iodine as a therapeutic alternative in surgical removal of the gland. The radioiodine therapy is considered advantageous over surgery because of the simplicity of its procedure, its applicability to patient, avoidance of surgical risk and complications. The next one is sodium iodide 131 solution and capsule. Sodium iodide 131 are suitable both for oral or IV administration. The solution is clear, colorless, but at the same time passes both the solution and glass may get darkened due to its effect of radiation. The pH of solution varies between 7.5 to 9. For injections, a suitable preservative such as benzyl chloride is added. A reducing agent such as sodium thiosulfate is also added to the solution. To prevent the oxidation of sodium iodide in aqueous solutions, potassium salt, iodide or iodide have been acting as a carrier for iodide ion and for iodide ion present in the solution sodium iodide solutions. Sodium iodide I-131 capsules are prepared by evaporating an alcoholic solution of sodium radioiodide directly on the wall of the capsule or on inert capsule filling machine. Radioactive identifications. The spectrum of 131 has been complex, but the most abundant type of proton is having energy of 0.364 millicurie. It is possible to determine the energy in spectrometer by detecting alpha radiations with a scintillation counter which is having a thallium activated. The gamma rays scintillation spectrum of sodium iodide solution has been found to be identical to that of specimen of I-131 of unknown purity, which exhibit major photoelectric peak having energy of 0.364 millicurie. Handling and storage of radioactive material. A great care must be taken in handling and storage of radioactive material so as to protect the people from its harmful effect. The radioactive material are stored in remote area such that it should be always be exposure to human beings. Alpha and beta emitters are stopped in thick glass such as shading effect is provided, while gamma emitters are stored in lead container. The area of radioactive material should be tested for intensity of radioactivity. Exposure to radioactive radiations can cause blood cancer to patient. Lead shielding is required while handling with radioactive substances. Shielding effect can also be achieved by water layer and concrete block. Water layer block only radiations while allow visible light to pass, while concrete block all the radiations. Storage of radioactive substances. Radiopharmaceuticals should be kept in well-closed container and stored in an area assigned for the purpose. The storage conditions should be such that the maximum radiation dose rate to which person may be exposed to reduce to an acceptable level. A care should be taken to comply with national regulation for protection against ionization radiation. Radiopharmaceutical preparation that are intended for parenteral use should be kept in glass vial, ampule or syringe that is sufficiently transferred to permit the visible inspection of the content. Glass container may darken under the effect of radiations. Precautions for handling radioactive substances. The following guidelines provide information on the safe handling of radioactive substances. They are based on the relevant legislation and on the code of practice for handling radioactive substances. First, the radioactive substances used should comply with the following characteristics. Radiotoxicity must be as low as possible. Short-living isotopes are preferred to long-living ones. The amount used must be kept to minimum. Never work alone in a radioactive lab, especially not outside normal working hour. Always make sure to have someone nearby in case of emergency. Take all the precautions to prevent radioactive contamination. Always separate radioactive material from non-radioactive activities. As far as possible, limit the area where radioactive substances are used and mark the area. Example, by using container with absorbent paper. Apply a radiation symbol to any container and item that have come into contact with radioactive substances. Never bring documents such as notes on the radioactive zone. When handling radioactive material, always wear the appropriate protective clothing. Wear a lab coat if there is a risk of serious contamination. Wear disposable clothing. Store your lab coat away from your regular clothes. Always wear gloves when handling radioactive substances. Regularly check the radiations level of those gloves. Never touch anything with potentially contaminated gloves. Use paper tissue instead. Wear a shoe cover in room where the floor may be contaminated. Keep personal items such as handbag etc. Outside the lab. Use appropriate radiation shield. Return the stock solution to storage immediately after removing the amount needed. To avoid internal contamination, strict hygiene is essential when handling radioactive material. Eating, smoking, drinking, and applying cosmetics are prohibited in radioactive lab. Never pipette by mouth. Use pipetting device instead. Wash your hand thoroughly when you leave the lab. Regularly check the radiation level of your working area and all objective used, or at least at the end of each working area. Replace contaminated absorption paper. Decontaminate contaminated object. Dispose of all radioactive waste in the appropriate container. Limit the amount of waste to a bare minimum. Separate a short-living or long-living radioactive waste. Labeling of radioactive substances. Every radiopharmaceutical preparation must comply with the labeling requirement established under good manufacturing practice. The label on the primary container should include a statement that the product is radioactive or the international symbol for radioactivity. The name of the radiopharmaceutical preparation, where appropriate, that the preparation is for diagnostic or for therapeutic use. The route of administration, the total radioactivity present at the date and where necessary. Time for solution, statement of radioactivity in a suitable volume. For example, in mbq per ml of the solution may be given instead the expiry date and where necessary time. Batch, that is lot number assigned by the manufacturer. For solution, the total volume. The label on the outer package should include the statement that the product is radioactive or the international symbol for radioactivity or the name of radiopharmaceutical preparation. Where appropriate and preparation is for diagnosis or for therapeutic use. The route of administration, the total radioactivity present at a stated date and the where necessary time. For solution, statement of radioactivity in a suitable volume. For example, in mbql per ml of the solution may be given instead the expiry date and where necessary time. Batch number assigned by the manufacturer. For solution, the total volume, any special storage requirement with respect to temperature and light. Where applicable, the name and the concentration of any added microbial preservative, or where necessary, that no antimicrobial preservative has been added. Pharmaceutical application of radioactive substances. Treatment of cancer and tumor. Americum 241 used as an antineoplastic, calcifornium 252 used as an antineoplastic, cobalt 60 used as an antineoplastic, gold 94 used as an antineoplastic, holmium 66 26 hours being developed for diagnosis and treatment of liver tumor, iodine 125 60 days used in cancer brachytherapy, that is prostate and brain cancer. Treatment of thyroid disease with iodine I-131. Iodine I-131 is therapeutically used for the to treat thyroid cancer, hyperthyroidism, including Graves' disease, toxic multinodular goiter, and a toxic autonomously functioning thyroid nodule, and the non-toxic multinodular goiter. Palliative treatment of bone metastasis. Various radioactives and radiopharmaceuticals are used to deliver palliative treatment of bone metastasis, including samarium 153, strontium 89, chloride, and phosphorus 32, sodium phosphate. The two most common side effects occurring from radiopharmaceutical therapy for metastasis to bone diseases are initial increased bone pressure and decreases WBC and the platelet count. Treatment of arthritis. Erbium 169 used for relieving arthritis pain in synovial joint. Diagnostic radiopharmaceutical. Ammonia 913 injection used for diagnosis coronary artery disease. Chromium 51 used for diagnosis and pernicious anemia. Holmium 166 used for diagnosis and treatment of liver tumor. Iodine 125 used diagnostically to evaluate the functioning of kidney, filtration of kidney. Then thank you.